everyone, in this video we want to discuss a major drug interaction between rizatriptan and propranolol. Rizatriptan is a medication of the triptan class used for migraine attacks. Propranolol is a medication, a non-selective beta blocker used for prophylaxis of migraine attacks. As both are used for migraine, it is much possible to be administered together. However, a main point to consider is that blood levels of rizatriptan may be increased by 70% when co-administered with propranolol. 70% is much considerable. So, the maximum dose of rizatriptan should be reduced when co-administered with propranolol. How should we do that? The usual dose of rizatriptan starts with 10 milligrams with each migraine attack. That can be increased up to 13 milligrams a day. However, when administered with propranolol, it should be started with just 5 milligrams and should not exceed 15 milligrams in a day. So here is 15. When co-administering these two medications together, the total dose of rizatriptan should not exceed 15 milligrams. Hope you enjoyed the video. Please like, subscribe and share to support the work.